Hello, I am Dr. Rashmi Shah. I am a laparoscopic surgeon, and I have had training in obesity surgery, and I have done fellowship in that, and also has been exposed to various kind of obesity surgeries like gastric banding, sleeve gastrectomy, Roux-en-Y gastric bypass. So all these procedures came more into the phenomenal world and in the awareness after 2000. And gastric banding was supposed to be done for, it was a reversible procedure where patients with morbid obesity, that is BMI above 40, and if they have BMI above 38 and plus two comorbid diseases like metabolic abnormalities and like diabetes, hypertension, asthma, or sleep apnea. So all these two conditions along with the morbid obesity of 38, so they were indicated to do gastric banding, and it was a procedure for initially people went for because it was supposed to be reversible. So the gastric band was placed at the gastroesophageal junction just 2 centimeters below it. So there is a food pipe and the stomach. And just below the gastroesophageal junction, a 2 centimeter pouch is created, and below it, a gastric band is placed, which is done laparoscopically. And with that used to have a pouch restriction, so that every time a patient gulps food or swallows liquid, he will have only 10 to 15 ml of contents at each time, so that it will reduce the amount of food that he's consuming. And they have to take a mashed food, initially liquid diet, and gradually it was the balloon was the insertion of the button was subcutaneous, so that we can fill the balloon and monitor it radiologically and fluoroscopically. This afterwards it used to be like over a period of 6 months, 8 months, 1 year, then the gradual weight reduction used to happen. But this was done for the first part of obesity, morbid obesity, not very morbid patients. But the complications while removing the gastric band used to be, there used to be adhesions, there's some rupture of that inside balloon, and patient used to again consume whatever food they want to eat. So more of this. Then again, when laparoscopic era started much more, so all these obesity surgeries were much more initially done for morbidly obese patients about 240 kgs or 200 kgs or BMI more than 44 or 42. But with the advent of laparoscopic surgery, with the keyhole surgery, where we do only pass a simple varus needle inside, put multiple tiny ports, and then laparoscopy. And then now with that era, it started in 2005 to 2007, the era of sleeve gastrectomy. So with that sleeve gastrectomy, what it is done is the stomach, which is like a jug or a balloon, it is made into a banana shape. So what we do laparoscopically is we put a cutter inside, and the cutter itself has a stapler. So like a stapler line, we cut the stomach, extra stomach, and just modulate the esophagus, the same like a esophagus thickening is like the stomach, but it is like an extended pipe like that way. In that, the phenomenon of two things are there. That means a restrictive procedure is done, and also a physiological procedure where it was supposed that the ghrelin hormone, which is a hormone which will suppress the satiety, which will like increase the satiety and decrease the hunger. So that hormone is usually in the fundus part of the stomach. So that if you remove it, the patient will definitely will have one of the two things, is that early satiety, less of hunger, and second thing is physiologically the capacity of the stomach is reduced to just like a banana. So in that, it's supposed to be done in patients who were around 40 to 44 BMI, and these patients have now no again it cannot be reversed because the tissue is completely removed away
once for
all. But the patients over the time have weight loss. But the thing is that gradually the stomach pouch, which is made as a banana, it dilates, and sometimes there is again recurrence of weight gain. The disadvantages of all this procedure, even if they are done through tiny hole or robotic surgeries nowadays, but the stapler line can leak, there will be adhesions to the stapler line, and it is a non-physiological way of reducing weight loss. Some of the other complications, stricture, which is the most commonest part that can happen at that junction, or narrowing of the tube, adhesions, these are all different complications these patients have.
Okay, now I'm Dr.
But
B.G.
the
Gokulan.
advantage of here that after coming
Chief
here
physician
with
at Sudarshanam Ayurveda Eye Hospital. Now, Dr. Rashmi Panch has reached here for the treatment of her eyes post LASIK complications. Meanwhile, she also wanted to have some therapies for her obesity, slightly obese than what she
and
used to be.
hypertension.
Hypertension. So we started with Churna Abhyanga, otherwise called Udvartanam. Udvartanam in Ayurveda actually is Udvartanam Kapharam Medasa Pravilayanam. It actually said that the kapha, the phlegm part in the body, the thick part in the body, or the solid parts in the body get eliminated and loses through the stool or urine. So it is a Udvartanam Kaphaharam. Kapha means the thick part, and it goes out from the body, and which makes the larger portion of the body weight other than water. So this phlegm is relieved outside and it reduces the weight. So how do you find the your experience with the,
of last 5 days simply is that it just like a powder therapy they have given all over the body for 45 minutes massage, along with diet therapy has been started, and with this therapy only in last 5 days I have a miraculous result of weight loss of 2 kgs, and also the inch loss has started, and I am feeling lighter, and my that was edema, that was like a fluid collection on my knees, my tibia and lower extremity have completely gone away. So obesity now it is more tend to be an inflammation in the body, and this kind of Ayurveda therapies has to be more highlighted, which is very natural and very important source of physiological source. Like physiologically you are reducing the weight, the excess. I can understand what Dr. Gokulan sir is trying to tell, but I want to have more information about what is the mechanism in how that drugs affect even subcutaneous, like on the skin they are applied, and how physiologically it melts away the fat.
First of all, the treatment actually, as I told you, this is to reduce the phlegm in the body. So the medicines which act on this, or ingredients which are seen in the medicines, are mainly of hot quality.
Okay.
There are 2 qualities, hot and cold. Okay, or Samashidoshna.
Okay.
So these are preferably hot quality, which alleviates the phlegm content in the body, and it increases the temperature in the body, in the skin area, and it reduces the fat. So this fat is traveled away. Traveled to the koshta. Koshta means stomach,
the inner digestive
area, and that is eliminated out either through urine or through the stool. So it's a very powerful treatment, which is especially useful in not only in the obese people, but as of Dr. Rashmi, this obesity caused due to inactivity for 3-4 months together and bed rest
because of my eye conditions and keratoconus.
She was not moving. So in that case, it acts very fast. So that is why I assume the result is very faster of 2 kilograms in 5 days therapy itself.
But this is a very much of advantage for all people who have obesity of around 35 to 40 BMI with hypertension, diabetes, or COPD, or like asthma or sleep apnea syndromes, metabolic abnormalities like cholesterol and lipid profile higher. In those patients, this is a boon, because taking this.
Here, added advantages are this is a non-invasive. There is no surgery, nothing is included. It's only a body therapy, like
it's a physiological way,
physiotherapy,
it's natural way.
And added to that, if we go with the Vasti, Vasti is another therapy, which a rectal procedure, which introduces about 400 ml of kashaya decoction mix with honey, ghee, oil, and decoction. All these medicines
are given per rectal.
It is ingested, and within 5 to 10 minutes time, defecation starts. About 2 to 3 times defecation starts, and the fluid is actually taken out. So this medicine has a potency to eliminate the fat
extra
in the body,
along with
and the body along other
With the
than
internal therapies.
other than enema. This is not an enema.
Yes,
The
yes.
procedure is actually, we term it enema because to make people understand.
Huh.
The medicine value is very high in this,
Yeah.
and as you know, the fastest absorption to the body by the food or whatever
Yeah,
things
it's per rectally when you
it's
administer.
through the colon, end of the
Yeah.
colon and the rectal portion.
Yeah.
So this principle is used in using the Vasti.
I
So
totally
along with this
admire
Churna
this,
Abhyanga,
yes,
along with
yes.
this Udvartana, if the Vasti is also produced, more
Absolutely.
result in weight reduction is
And also it is helping you internally to change the lipid abnormalities. And I have experienced myself last 4 months back when my lipid profile was abnormal, and I had taken Vasti for treatment for my eyes, along with this medicines they have given for the lipid profile which were abnormal, and definitely it had worked a miracle for me. So, and this is also a part of total colonic. Inside they are absorbing it, the intestinal epithelium cells gets more immune, the whole body detox process has started.
Yeah. And more than that, to add to it, in surgery, unlike in the surgery, a patient after the surgery requires vitamin supplements.
Yeah.
Because the absorption of vitamin is restricted.
Yeah.
As you told, the
multiple complications are happening.
Hunger is reduced,
Yeah.
and ability to eat more is reduced. Absolutely, this thing. So the body is actually getting starved.
Yeah.
The body, the fat content. So the fat ablation, fat destruction is too fast. The body cannot
and more
tolerate
about
that.
it is complications, because not every individual which is really in highly required all this kind of very invasive and morbidly like these are some kind of disadvantages for these surgeries, like
so Ayurveda actually what I feel, though the results may be comparing to the surgery, it may be slower.
Yeah.
But 2 kilos in 5 days is not a very slow process.
And gradually it will improve, because you know,
Yes.
understand the lifestyle mechanism to change.
It's a
and
bio-friendly.
diet.
It's a bio-friendly mechanism, bio-friendly procedure, which does not give any harm result in the body.
Yes.
So thank you so much for having given this feedback within a short time, and your observation is exactly being a technical professional as a doctor. It has helped out to clarify the things.
And especially for patients who have not very high BMI, they could come here and experience this modality of treatment along with internal detox process and internal medicines which are given, so that all the abnormalities they reduce and they have a healthy lifestyle and well-being.
Thank you.
Okay?
Right.
Thank you.